In a world where medical bankruptcy affects millions despite insurance, Amish communities face $50,000 to $150,000 surgeries without coverage through cash payment discounts of 30 to 50%, church aid funds, and community benefit auctions raising $20,000 to $100,000. It's community mutual aid preventing medical debt crisis. Medical philosophy. The Amish approach to modern medicine is selective use based on condition severity, combining initial reliance on natural remedies with willingness to seek surgical intervention when conditions become serious. Acceptance of modern medicine for serious conditions means Amish patients will undergo surgery for appendicitis, broken bones, cancer requiring tumor removal, heart conditions, and traumatic injuries from farm accidents. The cultural belief that God provides healing through human hands makes modern surgical intervention spiritually acceptable. Rejection of preventive care and routine checkups means annual physical examinations, routine blood work, mammograms, and colonoscopies are generally avoided. This preventive care rejection means many conditions are discovered later when symptoms appear rather than through early screening. Natural remedies first approach means initial response to illness involves rest, dietary changes, herbal tinctures and teas, and allowing the body's natural healing processes to work before seeking medical intervention. A persistent cough is treated with honey and herbal remedies for weeks before considering a doctor visit. Modern intervention threshold is reached when natural remedies fail, when pain becomes unbearable, when the condition clearly requires surgical repair, or when family observes dangerous symptoms like severe bleeding or difficulty breathing. Trusting God's will combined with acceptance of treatment creates theological framework where seeking surgery is not lack of faith, but appropriate use of healing tools God provides. Prayers before surgery ask for God's guidance of the surgeon's hands. The outcome, whether recovery or death, is accepted as God's will. Finding doctors. The process of locating appropriate medical care involves seeking doctors and hospitals willing to work with Amish payment methods and respectful of cultural practices. Preference for doctors willing to work with cash payments means seeking physicians who will provide upfront cost estimates, offer cash payment discounts, and accept payment plans. These Amish-friendly doctors understand that cash payment will arrive, perhaps not immediately, but certainly over time. Travel distances of 30 to 100 miles to reach Amish-friendly hospitals reflect that not every medical facility welcomes cash-paying patients. The Amish family will drive past 3 closer hospitals to reach the facility known for fair cash pricing and respectful treatment. Word-of-mouth referrals within the community mean excellent doctors and hospitals become known throughout the Amish network across multiple states. A surgeon in Ohio who treated an Amish patient fairly will receive referrals from communities in Pennsylvania and Indiana as families share information about quality care providers. Mennonite Medical Messengers Program provides transportation to medical appointments for Amish families. These Mennonite volunteers drive Amish patients to distant hospitals, wait during appointments and surgeries, and transport them home afterward. Pre-surgery consultation. The decision-making process involves extensive family involvement, detailed cost discussions, and community elder consultation, creating collective approach to major medical decisions. Family accompaniment means 3 to 6 family members attend every appointment: the patient, spouse, adult children, parents, or siblings. These family members participate actively, ask questions, and contribute to decision-making. The surgeon explains the procedure to the entire family group, understanding that the decision will be made collectively. Recovery time and workability questions reflect practical concern about how long the patient will be unable to work and how this affects family income and farm operations. The family needs this information to arrange coverage for the patient's normal work responsibilities. Cost discussion up front is explicit and detailed. The Amish family asks directly, "What will this surgery cost in total, including hospital stay, surgeon fees, anesthesia, and all related charges?" The hospital financial counselor provides itemized estimates. This cost transparency allows informed decision-making, Cash discount negotiation happens during this consultation with the family, asking what discount the hospital offers for immediate cash payment or payment within 30 to 60 days. The typical response is 30 to 50% off the chargemaster rates, bringing a $100,000 build procedure to $50,000 to $70,000 cash price. Decision made by patient, family, and church elders involves consultation beyond immediate family when costs are substantial. The church elders provide both spiritual counsel and practical assessment of whether the church aid fund can support the costs. Payment system. The financing mechanism operates through a three-layer system combining individual savings, church aid fund contributions, and community fundraising. Rejection of health insurance reflects theological principle that mutual aid should flow through church community rather than commercial insurance companies. The Amish view insurance as betting against God's provision. The religious objection is strong enough that Amish are legally exempt from mandatory health insurance requirements. Church Aid Fund operates through monthly contributions from every family, typically $20 to $50 monthly from each household, creating a collective fund of $5,000 to $15,000 monthly in a district with 250 to 300 families. This fund pays medical expenses for any church member experiencing costs exceeding family resources. Individual family savings represents the first resource, with families expected to maintain emergency funds for unexpected medical costs. A typical Amish family might maintain $5,000 to $15,000 in savings specifically for medical emergencies. Hospital negotiation for cash payment typically achieves 30 to 50% reduction from billed charges. A surgery billed at $100,000 becomes $50,000 to $70,000 for cash payment. The hospital accepts this discount because cash payment eliminates billing costs and collection efforts. Cash payment after discount brings costs to $25,000 to $75,000 for most major surgeries. The family pays from savings what they can, perhaps $5,000 to $15,000. The church aid fund covers the majority, perhaps $15,000 to $40,000. If additional funds are needed, the community mobilizes through benefit auctions. Community fundraising. The benefit auction system mobilizes when medical costs exceed family savings and church aid fund capacity, creating community events that raise $20,000 to $100,000 while simultaneously strengthening social bonds through collective support of member families. The auction organization begins when church leaders determine that the medical costs will exceed available church aid resources. The family needing assistance is notified that a benefit auction will be organized, and the entire community is informed several weeks in advance, allowing time for donation, collection, and auction preparation. The community donation of items for auction includes handmade quilts worth $500 to $3,000 each, handcrafted furniture worth $1,000 to $5,000, livestock worth $200 to $2,000, produce and baked goods, tools, farm equipment, and countless other items contributed by community members. The quality of donated items is high because contributors understand that better items generate higher bids and more money for the medical fund. The auction attendance of 300 to 800 people includes the entire local Amish community, plus Amish from surrounding districts and English neighbors who support the community through auction participation. The large attendance ensures competitive bidding and high prices for auctioned items, maximizing funds raised for medical expenses. The single auction raising $20,000 to $100,000 in a single day represents the collective financial power of community mobilization. A smaller benefit auction for a less severe medical situation might raise $20,000 to $40,000. A major auction for catastrophic medical costs, like extended cancer treatment, might raise $70,000 to $100,000 through hundreds of items sold to hundreds of bidders. The social event dimension means the benefit auction is not somber charity, but celebratory community gathering, featuring food, conversation, children playing, and the reinforcement of bonds that make the community strong. The family receiving assistance is not pitied, but honored as worthy recipients of community support. The contributors are not sacrificing but participating in the mutual aid system that will support them when they face similar needs. The 100% of proceeds going directly to medical costs means no administrative overhead, no organizational expenses beyond the minimal costs of auction setup. Every dollar bid goes to paying hospital bills, creating exceptional efficiency compared to charitable organizations that spend 20 to 40% of donations on administration. Hospital experience. The inpatient stay for surgery and recovery differs markedly from typical modern patient experiences due to cultural practices around family involvement, modesty, religious observance, and pain management preferences. The admission with family members means 3 to 6 relatives accompany the patient from admission through discharge, staying continuously in the hospital room, sleeping in chairs or on floor, and maintaining constant presence. The hospital staff accommodates this family presence, understanding that Amish patients expect family support throughout the medical experience rather than the isolated individual patient model modern hospitals assume. The traditional dress maintained throughout hospitalization means Amish women keep their prayer coverings and modest dresses rather than changing into hospital gowns. Men maintain their beards and plain clothing. The hospitals accommodating Amish patients allow these dress code variations, understanding that modesty requirements supersede hospital uniform policies. The only exception is during surgery when surgical gowns are necessary for sterility. The prayer before and after surgery involves the family gathering around the bed praying together before the patient is wheeled to the operating room and again immediately after the patient returns from recovery. The minister, if present, leads these prayers asking for God's guidance and giving thanks for healing. The hospital staff pauses to allow these prayer moments rather than rushing the patient through pre-surgical and post-surgical protocols. The limited pain medication reflects cultural suspicion of narcotic addiction and belief that some suffering during recovery is natural and acceptable. Amish patients typically request minimal pain medication, preferring to endure discomfort rather than risk medication dependence. They accept non-narcotic pain relievers but resist opioid prescriptions, often taking half the prescribed dose or discontinuing pain medication earlier than doctors recommend. The early discharge preference means Amish patients request release from the hospital as soon as medically safe, often pushing to leave 1 or 2 days earlier than typical discharge timelines. The family's ability to provide intensive home care makes early discharge feasible since the patient will receive 24-hour attention at home rather than being alone in an apartment as many modern patients would. B. The hospital must balance medical safety against patient preference for home recovery. Recovery at home. The post-surgical recovery period involves intensive family caregiving, community meal support, and integration of herbal remedies with prescribed medications, creating comprehensive care that modern discharged patients rarely receive. The family 24-hour care involves daughters, sisters, daughters-in-law, or mother rotating shifts, staying with the recovering patient, helping with personal care needs, administering medications, preparing meals, and providing companionship during the recovery period, lasting weeks to months depending on surgery severity. The community meal provision brings 2 to 3 prepared meals daily to the recovering family for 2 to 4 weeks after surgery. Different families sign up for specific days, arriving with complete dinners including main dish, sides, bread, and dessert sufficient to feed the entire household. This meal support eliminates cooking burden during recovery, allowing the primary caregiver to focus entirely on patient care. The modified work arrangement allows the recovering patient to perform light tasks during recovery rather than complete rest. A farmer recovering from surgery might feed chickens while avoiding heavy lifting. A carpenter might do shop paperwork while avoiding physical labor. This gradual return to activity is believed to aid recovery rather than hinder it, keeping the patient engaged and purposeful rather than idle and depressed. The herbal remedies alongside prescribed medications include teas supporting healing, poultices on surgical incisions, and supplements believed to strengthen recovery. The family doesn't substitute these remedies for prescribed medications, but adds them as complementary treatments, combining modern medicine with traditional healing knowledge. The return to work as soon as physically possible reflects both practical necessity, farm work, and household tasks require doing, regardless of personal health and cultural belief that purposeful work aids healing. The recovering patient resumes light duties within 2 to 3 weeks and full duties within 6 to 8 weeks, even when doctors recommend longer recovery periods. Financial aftermath. The final cost resolution involves combining church aid payment, family contribution, and any remaining balance cleared through payment plans or